Because we're going to talk about hypoglycemia. How does hypoglycemia takes place in a diabetic patient? So remember, this is an acute complication for diabetic patients. So hunger, empty feeling, lack of concentration, confusion, sweating, palpitation, convulsion, and loss of consciousness. Now, what are the main symptoms? Now, certain things you know that the frequency varies from person to person. Remember that. That's one of the main things. It all depends on oral or the type of insulin taken. Now, hypoglycemic state is seen when it's less than 40 mg percent, while hyperglycemia in severe cases is seen more than 30 mg percent sugar. Now, what are the common symptoms as we discussed? Sweating, pallor, hunger, fatigue, inability, increased heart rate, and lack of concentration. Something you can headache is also seen. Double vision is also seen. Is similar to epilepsy or seizures. So before having any person having any of this should rule out hypoglycemia. Well, at night hypoglycemia occurs. What all are there? Nightmares, difficulty in sleeping, sweating, early morning headache / fuzziness. So remember this. In prevention of this, dose of insulin should be accurate, and I mean very accurate. Now, how do we differentiate an hypoglycemic and a hyperglycemic state? Well, in diabetic patients, it happens gradually over hours. Well, in hyper, gradually over days. So remember this: hours, days. Less than 40, more than 300. In terms of blood test, urine test, no sugar. Well, here sugar is present. Symptoms, as we discussed before, for hypoglycemia and hyperglycemia. So what are the treatment base? Eat something sugary. Do not omit the insulin if you're taking insulin, but same time try to maintain the sugar balance. Here, call for a doctor and admit it as early as possible. In a severe hypoglycemia, use of an insulin reaction, dry skin, nausea and vomiting, rapid breathing, and blood sugar more than 300. Sweating, hunger, nervousness. This is what we can talk about hypoglycemia and its complications. To just revise, so we have talked about hypoglycemia, how it's been acute complication, frequency vary from person to person, how oral and insulin drugs in its doses are responsible, less than 40, more than 50 to 300 is hypoglycemic, sweating, pallor, hunger, fatigue, anxiety, rapid heart rate and lack of concentration. Its DDs are epilepsy and seizures, at night, nightmares, difficulty in swallowing, sweating, early morning headache, fuzziness. We talk about the differences and also severe hyperglycemia and insulin. Thank you.